Hello, my name is Tori Gallego, and I'll be talking about ADHD medication and the working memory. So, a little fun fact about myself is that I actually have ADHD, but I actually wasn't diagnosed up until recently this year. And through my diagnosis and through getting medicated and all that, I wanted to do a little bit more research on ADHD, just to get a better understanding for myself and what I've been going through my entire life. So, as we know, ADHD has been very prevalent in the media lately, especially with untreated adults that are dealing with ADHD. And according to psychiatrist Dr. Leonard Adler, adults with untreated ADHD are more likely to obtain a lower education, they're more likely to earn less money in a job, and change jobs or lose jobs more frequently. And in our Psych 324 memory and cognition class, we were discussing the working memory. And through our discussion, I was really curious about how this affects people with ADHD, and more specifically, how ADHD medication affects the working memory in people with ADHD, of course. So, Wong and Stevens were interested in finding out how stimulant medications affect the frontal parietal network activity and functional connectivity in ADHD. They wanted to focus on the frontal parietal networks because it demonstrates importance to the working memory. So participants took part in a Sternberg working memory fMRI task where they had to complete a 7-minute task, and subjects had to memorize a list of letters. They maintained them to memory, and then they differentiated the seen letters from the unseen letters. The fMRI measured the brain activity, differentiating between the different phases of the memory, and in turn, the brain activity determines effect of the medication on the task performance. So what they found was that the correct dosage of the stimulant medication, it actually altered the regional brain functional connectivity during working memory in the frontal parietal networks, which is evidence that stimulant drugs that help people with ADHD re-engage the regions of the brain. So Holmes et al. Was also interested in the different impacts of working memory with a training program and medication that hasn't shown with ADHD. So what they did was they had children complete 8 memory tasks, where one was on the medication and one was without the medication. And what they found was that there was actually effects on improved scores with the visual spatial working memory, but there was no improved scores with the verbal working memory. And this can be because of the attentional control with the ADHD or the stimulant drugs and the right hemisphere activation. So now that we know that ADHD, it really does have an effect on the working memory, what do we do? So if you have ADHD, just make sure you're getting the right accommodations for yourself. Just remember, you're not stupid. And be kind to everyone. Be kind to your peers, be kind to your colleagues. You never know what disabilities they're going through. Thank you so much.